Welcome, everybody. Thanks for coming this evening, being in person, as well as those that are over video conference. I'm Brad Jacobs. Fortunate to be here with Lisa, our resident acupuncturist.
Thank you for having me.
We are here doing our Tuesdays to Your Health talk, and we do this once a month. And we're fortunate to have Lisa with us this evening. And tonight we're going to be talking about Chinese medicine and specifically acupuncture. Let me orient you for a moment if you haven't been to one of our conversations here. We do it once a month, typically the second Tuesday of the month. And we're located in Cavallo Point Lodge here in Sausalito, California. And we're fortunate to be in the gorgeous Healing Arts Center and Spa here at Cavallo Point. But this evening we'll be spending a lot of time chatting about Chinese medicine. We run a practice here called BlueWave Medicine. And in BlueWave Medicine, we focus on an integrative, a holistic approach towards care, primary care. We're fortunate to have Lisa as part of the team, of the ecosystem. There's about 18 of us. And she really provides a deep knowledge around both the body and body work, as well as the mind, body, spirit, looking through a Chinese medicine lens. So I'm excited to be in conversation together this evening. So maybe I'll start with a little bit. The way we're going to structure the evening, I should say, is to have some conversation. I'm actually going to be a guinea pig unless someone else volunteers and wants to take their shirt off and get on the table. So if you guys have questions that are virtually watching us, feel free to put those in. For those that are watching us live, this will be put up on our YouTube channel, so let people know. If they don't see it, they can go to our YouTube channel, which is Brad Jacobs MD, and you can find all the archived conversations that we've had historically as well in the future. So a little bit of a background. I'll just say that I know a bit about Chinese medicine. I'm a medical doctor by training, internal medicine trained in integrative medicine. But along the way, I was born and raised doing martial arts, and specifically as like a teenager, Lisa, I started doing Chinese martial arts, which really led me and I've been doing it since I was 18, and now I'm approaching 60. And it's been mostly Chinese martial arts. So I was really actually considering going to Chinese medicine school, acupuncture school, or medical school at the time, and opted for the medical school plan. But then on the backside of my training, I did do what's called the Helms Medical Institute, which is medical acupuncture, and which is 300 hours of acupuncture training versus 4 or 5 years of acupuncture in Chinese medicine training. Very different. Did that full training back 23 years ago, and then realized it really wasn't quite enough. And I went ahead and did what's called 5-element. At least we'll be talking about 5-element. 5-element training under someone called J.R. Worsley, who's out of the UK. And 5-element really deals with spirit, emotion, psycho-emotional, and spirit. It's also body, but really at the spirit level. So that's my orientation. I'm going to have Lisa talk about hers, but I just wanted to orient you, give you a little context of me. And I found myself partnering with really veteran, experienced Chinese medicine practitioners. So I would treat some basics up, but I would often refer people. When I was at UCSF running the Osher Center for Integrative Medicine, I had some amazing practitioners, and I would refer them to my patients. And likewise, here at BlueWave Medicine, I'm fortunate to be working with Lisa, and so I get to refer them to you. So maybe give us a little bit of the background. We've talked about your story a little bit, if you don't mind sharing it with the group, around sort of your love for the water and how that got you into Chinese medicine.
Absolutely.
Yeah.
So in my early 20s, I spent a lot of time traveling all over the world surfing, and found myself in very remote places without doctors, without any medical facilities. And through those experiences, I came back wanting to have some type of medical training. And I had an injury from surfing where I was going under a pretty good size wave, and I threw my back out. I got a facet locking syndrome in my low back, and I went to see an acupuncturist, and that was my first experience with acupuncture. And it really blew me away how effective it was. After one treatment, my back was about 85 to 90% better, and with the second one, I was back to normal. So I was very intrigued by the practice and the holistic approach to healing, not separating emotions and spirit from the body. So I started digging in, doing my prerequisites, and then started the 4-year program. Also, my mother grew up in South America, and her grandmother, so my great-grandmother was Guajira Indian, and she was the medicine woman and the healer of their group, and she used plant medicine and took care of people. And so every year for Dia de los Muertos, I always have pictures of my family, and she always was looking at me. You know, she has these very deep, dark brown eyes. And so it was also a kind of a calling to help people and treat people and, you know, help people feel better. So.
Yeah. So, I mean, everyone that I know that sees you finds you to be a deep healer beyond your Chinese medicine training. Like there's something beyond that happening. You also did a lot of body work, right? So,
yeah.
And tell me about maybe the sequencing of that, like Chinese medicine, body work.
Of course. So I went to massage school actually before I started Chinese medicine school. So it was kind of very close together because I finished my prerequisites and did body work for years. Also incorporate it today. I don't, do full body massage anymore. It's more clinical. So I integrate different modalities into my work. I worked at Post Ranch Inn for a few years. I worked here at Cavallo Spa since they opened for 10, 11 years before shifting over with BlueWave. So, and in Chinese medicine school, we were trained in Tui Na massage, which is a little bit different than the massage that you receive in a spa setting. It's done on top of the clothes. You can also do it, straight on the skin also. So I did some training in Esalen style massage in Big Sur when I was working at Post Ranch Inn. So I find combining modalities is the most effective versus just doing needles or just doing massage.
Yeah. So I want to orient you a little bit towards that background because I feel like there's a lot you bring into the healing environment. Your knowledge of the body through your own surfing and just activity in general, your own experience through back issues, then your bodywork training, the Tui Na. And maybe we can spend a moment, just let me frame for those that don't know about acupuncture. In the United States, it's a little different. So there's, correct me if I'm wrong, but there's like the TCM training method, traditional Chinese medicine approach. There's a 5-element approach, which is, so you could say it's a subset, but also sort of different, right?
They're very connected. So TCM uses 5-element in diagnosis and treatment, but then there's a whole different style and approach of acupuncture through 5-element, specific, just 5-element work.
Right.
Yeah.
And then folks that are trained in, quote, acupuncture, that become licensed acupuncturists, are typically trained in needling or acupuncture. They're trained in herbal medicine and trained in bodywork like Tui Na. They're trained, I think, and then there's other categories, I guess, nutrition.
Yes.
Is there, and diet?
Yes.
Is that all of them?
Yes. So diet, nutrition, massage, cupping, gua sha.
Yeah. So we'll demonstrate the cupping, gua sha, maybe some needling today. Well, Lisa may have a different point of view, but my understanding is a bit more of the internal medicine, the organ-based treatment, the deeper, more penetrating, more risk and more benefit using like herbs and pretty complicated. And the needling can be a range from mind, body, and spirit. But that's my interpretation. What's your thought?
Yes. So the summer before my last year, my 4th year in acupuncture school, I studied in China, in Hangzhou, China for 2 months. And there's people that just do acupuncture and then other people that are herbalists. So it's not uncommon for one person, for somebody to focus on acupuncture or the other herbs. It really was like learning a whole new language and seeing the body in a whole new way. It's very different from the Western mind, the Western understanding of medicine. And so it took really opening your mind to a new way of thinking and treatment.
Yeah. And so I think there's, if you're a good herbalist, I forget how many herbs you need to memorize for your exam. 500, right? Yeah. And then you use them in combination. So 500 herbs that you use in combination. Think of how many permutations that is. And so you might have 2 herbs in a formulation. You might have 8 herbs in a formulation. There's a recent study that was published in, I forget which, I think it might have been JAMA, Journal of American Medical Association, think it was, looking at a combination herbal formula that actually has insects and herbs in it combined that showed a reduction in heart attacks, acute coronary spasm. Big study done in China, published in JAMA, big deal. It was a patented drug, herbal medicine, but super complicated. My friends that are in Chinese medicine world were commenting like, I can't believe that JAMA was willing to publish this. It's particularly because in one of the editorial sections they talked about, well, we really don't know the mechanism, so I don't know how much I can believe this. Meanwhile, the outcomes were death and heart attack. So do you really need to know the mechanism? It's great to know the mechanism, but I think you can trust that the herbs might help. But it's super complicated. In that formula, I think there are 8 different herbs. So really interesting. Today, we're going to focus a bit on needling, but I just want to give a little context. In most of the states now, I think you can be licensed as an acupuncturist. I think all the states. It's taken a long time. In 1970, 1972, Miriam Lee was actually arrested for practicing acupuncture in Palo Alto, put in jail, and was then finally released through a range of political relationships. But we've come a long way. It's been 50 years for being arrested for practicing acupuncture till now. So maybe, do you want to talk about 5 elements a little bit and sort of frame that conversation?
Sure. I'll just start with the actual elements. Fire is associated, there's 4 officials meaning they separate the 12 primary organs. So in fire, we have heart, small intestine, triple burner, and pericardium. There's paired organs within each element. And fire is associated with the summer, joy, and then it goes into late summer, which is the earth element, spleen, stomach, and that's associated more with sympathy, worry. Metal is associated with lung, large intestine, and that is associated with loss, letting go, grief. Going back to earth and going back there has more to do with our connection with our mother and our home, relationships with food, boundaries in life, whereas the metal element is more associated with our connection to our Father and any type of spirituality, our connection to something greater than us. Water element is associated with the kidney and urinary bladder. The emotion with that is fear. It also has to do with our capacity, like what we're capable of. And winter, so water is the kind of the darkest time of the year and the coldest time of the year, which is winter. And then, going back to metal is fall, autumn. And then wood is associated with spring, liver, gallbladder, anger is the emotion. A lot of organizational skills, people that want things very organized, detail-oriented, control, decision-making, indecisiveness, and wind. So that's a big part of the wood element. So
you got the 5 elements. So it's same again. They're fire, earth,
metal, water, and wood.
And each one, so if you heard that, is paired with like an emotion, a color, an element, a time of year, specific organs, and how those organs, when they're in disharmony, let's say liver, where you're really good decision making, and when it gets out of balance, you can't make decisions. It's like too much, it's overfilled. Yeah.
And then there's a generating, nurturing relationship, a attacking, counterattacking. So there's ways that all of these elements and organs work together, and how your body is either in harmony or not, in balance or imbalanced. So when someone walks in, and part of our training is to start observing immediately, their face, the color of their face, how they hold their body, their hair, all the details you start looking at. Tongue is a big one. We do a tongue diagnosis, pulse diagnosis. So really when someone comes to see me, I immediately start observing them the second they walk in the room. And a lot of that correlates into 5-element diagnosis and what kind of points that I'm going to use in that treatment.
I'm wondering a little bit about what you see most commonly in the busy, hectic Bay Area. It's probably different than if you're out in Hawaii or, hanging out in Iowa. I'm curious what sort of presentations you see and maybe give a couple examples.
I'd say a lot of aggravated livers, a lot of stress, and people feel very overstimulated with, the way we're living these days. There's so much intake. So accessing the parasympathetic, and I find acupuncture is very effective for that, even more so than massage. I have certain clients that are very busy, very high stress lifestyles, and a few needles go in and they're knocked out. So I'd say stress is the main one, musculoskeletal issues, anxiety, depression. Going back to the 5 element, the liver wood element deals with how we internalize stress, manage stress. And when the wood liver is out of balance, the first thing it attacks is the earth, which is spleen and stomach. So that would be digestive issues, which is very common for people that are under a lot of stress. Neck, a lot of neck issues, upper back tightness, people on their phones looking down, people on computers, driving. I'm driving around here is very stressful. So, this grip, everything tightens up, low energy.
And then what do you so you can do needling. What other general, we can talk about myself eventually and give something specific maybe, but in general, what sorts of recommendations do you find yourself giving people from a Chinese medicine 5 element lens?
One of the first things I would recommend is avoiding cold drinks, avoiding cold raw foods, because it's making your digestive system work twice as hard. So staying away from ice in your drinks. And if, I really like the Japanese take with sushi, it's cold and raw, but then they give you wasabi and ginger, which really balances the cold and it helps the digestion. So a lot of Chinese medicine, I think, is trying to find balance.
Yeah, so the wasabi and ginger is heat producing. So you're something that may create dampness or cold, and then you balance it with something that generates heat.
So if someone really loves their salads, I say have a cup of warming tea with it, like chai or cinnamon tea, something to help balance that cold salad. I do recommend, different exercise things, foam rolling, stretching, dietary recommendations. It's so different for each person, kind of hard.
We could talk a little bit about, do you want to use me or someone specific as an example? Do you want to talk to me? Sure. So maybe we can share a little bit of, I'll be vulnerable and talk a little bit about myself, and we'll watch Lisa's diagnostic eyes in mind, and then we can sort of do a quick demo and you can see what she actually does. Sound good? Okay. Hi, Lisa.
Hi, how are you doing?
I'm doing well. I've been, had a great Thanksgiving, super busy though. I've been doing a lot of surfing lately. There's been a huge amount of surf coming through the Bay Area. It's been amazing. Really big, powerful surf. So it's been super humbling, pretty exhausting physically. Like it's very demanding on this aging chassis, and generally getting good sleep, but not quite enough sleep. I dropped my daughter off early this morning to fly back to the East Coast. So I was up at 5 a.m., going to sleep at maybe 10:30, 11. So I like a lot of sleep, 7-8 hours, preferably 8. I'm not always getting it. So, and pretty stressful. The practice is growing and there's a lot of personal stuff going on. So under a fair amount, there's a lot of inputs coming in, but happy, generally speaking. And in my body, it feels, I'd say, it's a little bit tight. I'd say my neck's tight. I'd say my glutes are sort of tight. Body overall feels pretty tired.
And so for your stress management, is surfing the main?
Yeah, surfing, yoga. So I tend to do yoga. I tend to bookend my day with yoga. So I'll do get up in the morning and do some yoga on my own, 5 to 15 minutes, sometimes 30. And then before I go to sleep, I try to do some yoga to really I feel like it's like taking a roller to my body, and also allows my mind to unload. So it really helps me sleep much more deeply. I'll even do that even if I'm only have 5 to 6 hours of sleep, let's say, ahead of me. I'll even take 20, 30 minutes and take away my 20 minutes of sleep that I have to do the yoga, because I sleep much more deeply. So I've been doing that, a little bit of meditation, a little bit of journaling. So I try and do all that, but I still feels like it's not enough,
Yeah. How's your digestion?
Good. I don't have reflux or bloating. I'm pretty regular. Bowel movements every day.
Any specific food cravings?
Any specific food cravings? Lately, I've been craving more foods. A little bit salty. Yeah. Salty seems fun. A little bit sweet, but not so much, really.
Okay.
I'd say more salty.
Can we go back to your sleep?
Yeah.
So, this morning you took your daughter, but how about, let's talk the last week or 2 weeks. Any patterns that you're noticing in your sleep when you're saying your sleep hasn't been great?
So too little sleep overall, like going to sleep later than I want and waking up sometimes earlier than I want to. Some nights have been disrupted sleep, like there's some agitation from personal stuff that's happening. But when that's not happening, I'm now like not looking at email before I go to sleep, which I normally don't do, but with the stuff that's happening, sometimes I glance and that's a mistake. So I've stopped that, and then I get to sleep way better. And in general, I'm sleeping well, although I do find myself getting up between 3 and 4 in the morning, same time of night, which is interesting because I know that there's a clock that relates to the officials, the organs of our body, and Lisa's going to tell us about that.
So 1 to 3 is the liver hour. And he did mention he's under a lot of stress. Obviously, he has a lot of responsibility with this practice. And then 3 to 5 is lung. And again, going back to the metal element, metal is associated with lung and has to do with loss, letting go, and grief. Yeah. And so are any of those things happening for you?
Yeah, there's a lot of letting go and grief happening in mostly in my personal life. So I think, so the timing's interesting. Yeah, 3:15, 4 in the morning.
Okay. And how have your lungs felt when you're doing cardio? Any issues there?
Yeah, they're a little bit more tested, a little bit less resilient. And recently, I had a viral infection, which I rarely ever get. I don't get colds. I haven't had a cold in like 8 years. But I had one probably a month ago, 3 weeks ago, and I had a lot of sinus stuff. Way more than I normally do. That lasted way longer than normal.
Okay. I recommend you keeping your neck warm. As we're moving into winter, definitely make sure you keep your neck warm.
And by the way, I really don't like wind. So like, if you ever go somewhere and there's like a ceiling fan in Mexico or something, I can't handle the wind. What's that about?
I think it agitates the liver. So you mentioned joy. Considering everything else that's going on, how has your mood been, aside from joyful?
I'd say overall, mood's been variable from sadness, a little bit of agitation, some anger, and joy. I've sort of hit all of them. I don't have that much fear.
So with everything that he's mentioning, I'm definitely thinking of points already to do with him on the liver channel, lung channel, heart channel, and I think we're going to do a back treatment today on the urinary bladder channel, which is a great channel that has points for every single organ on the body. It's the only meridian that has points for every organ, so it's a great channel to work on when there's multiple things going on. And he's a surfer, so I know with surfer, you're in a prone position, almost like a cobra on the board, so his low back's going to be engaged and paddling like this. So I'm sure there's a lot of tension in his low back, upper back,
neck, right? Yeah.
Right. Any repetitive imagery in your dreams? Anything popping up in your dreams?
Not really. I have to think about that one.
Okay. Get back to me.
Yeah.
Yeah. So the wind, back to the wind comment, that's really associated with the wood element and liver. So liver also has to do with control, lack of control. And wind is just aggravating, right? It's a very tenacious thing. It doesn't let you forget it's there. Yeah. So I have another question. How's your energy been?
Pretty good. Yeah.
Do you supplement with caffeine?
Sometimes, yeah. So I'll do tea, oolong tea in particular. And then sometimes I've been doing coffee, caffeine, like, cappuccino or something like that. Yeah. But I do it more for fun than, like, I wake up awake, so I don't do it so much for the energy. I do it more, I love the ritual of tea, and I love the sort of the fancy, fun cappuccino drinks. I don't really do it to, like, wake my brain up per se.
Okay. So you have good energy.
Yeah.
Then.
But I'm ready to go to sleep early. And then sometimes I have to push through to get some stuff done.
Okay. So when you're waking up around 3 or 4, are you able to fall back asleep pretty easily, or is your mind racing?
Yeah, usually I fall back asleep pretty well, unless I read the wrong email and go to sleep agitated. Then it's harder to get back to sleep. So don't do that.
So can we see your tongue?
Sure.
So I'm going to stand up so we can see that.
So in typical Chinese medical practice, my understanding is you get a good intake like we just did. Sometimes they'll even ask you things like, what's the color of your urine? Is it frothy? Is it bubbly? They ask that for certain reasons that we don't typically ask. Although bubbly in Western medicine would mean a lot of protein, like too much, you're spilling protein in your urine. I don't know what it might be if it's frothy in Chinese medicine. But, and then they'll do after the intake, so tongue and pulse, right? And some people do abdomen. Yeah.
A lot. I mean, that's like
right.
Essential.
Bowel health, yeah, gut health, which functional medicine that many of you know about will talk about. You're good. We'll talk about the gut health in a different lens of gut health, but it's really interesting that a multi-millennia old tradition, Chinese medicine or Oriental medicine, is been talking about gut health for thousands of years, and functional medicine, naturopathy has been talking about it more recently. Yeah. You want to see my tongue?
Yes, please.
Okay.
Oh, so you just had that coffee.
That.
Yes. So it has a little yellow in it. So his tooth is definitely showing signs of heat. So the tip of the tongue is lung and heart, and then the sides of the tongue is spleen, stomach. So he's definitely showing a little excess heat in his lungs. And normally a yellow coat would mean heat or damp heat. But this turmeric can really change the color of the coat.
So turmeric's bright orange, so I guess my tongue has that bright orange look.
Yeah, so he does have some dampness, but generally very healthy. So it's amazing the difference in people's tongues, the variability.
Yeah, some people have, if you look at your own tongue, you may see a deep groove, you may see like a charcoal color down the middle, scalloping along the sides, thickness. Some people get a white moisty thing on top, right?
Absolutely.
Yeah, cracking.
The scalloping is from a tongue that's very swollen, so that's a sign of excess water in the body, too much, maybe someone that's retaining too much water. So the tongue pushes into the teeth and it leaves teeth marks on the tongue. So, should we feel your pulses?
Yeah.
Okay. Normally I like people having their feet on the ground, but we're going to just do it this way. No. So we feel the pulses in 6 different positions, and then there's a superficial and deeper pulse, so it's technically 12. And so we're looking for the quality, the rate, not necessarily counting like a Western practitioner would do.
So we typically, as a conventional doc, would look at rate, what's your heart rate, and rhythm. Is it regular or irregular? And only rarely do we look at sort of that feel into like the strength of it. Like if someone's passed out on the street, this happened to me like 3 weeks ago actually. Someone was passed out on the street, and you try and feel like, can I feel a pulse? Like, is there a blood pressure? Like, can I feel a pulse? But they look at it, they have 3 different positions on each side at 2 different depths. So that's 3, 6, 3, 6 is 12. And a lot of different qualities to it.
Right. And it's the paired organs. So right now I'm in lung, large intestine. So that's metal. spleen, stomach, earth.
Just the second position. And then the third position.
So his pulses are very steady, slow, a bit thin. And the kidney pulses are definitely deeper. So as we get older, the kidney energy declines and can be affected by overwork, excess in anything, too much exercise, too much drinking, too much drugs, too much sex. All of those things affect the kidney chi. I'm not saying that's what's going on with you, but Dr. Brad takes very good care of himself, obviously. So his pulses feel pretty good. A little wiry. There's some stagnation. So you need a good tune-up.
Yeah, I could use a good tune-up. I'll take it. So we thought maybe you guys would benefit from just watching me be a guinea pig, unless anyone else wants to volunteer. Otherwise, I'll get myself on the table. Okay.
So I'm going to have him go face down so we can treat the back of his body. And Dr. Brad asked that I do a demonstration also with some gua sha and cupping. So first we're going to do the needles, and we'll do the cupping and gua sha later on. So the needles we use are all one-time, one-use, disposable. The origins of acupuncture, they would use bones. And do you want to get under? Or no, you're comfortable? Okay. Let me know if I need to adjust that headrest. Are you comfortable? Yeah. Do you need a pillow under your feet? A bolster?
Sure.
Okay. I don't have. We'll just use 2. There you go. So being that I did so much body work, I always like to start with my hands on the body before I get the needles in. So the rector spinae on his back, the muscles that go along his spine are pretty taut, which is expected. And the base of his neck also. So this is a really sped up version of what we do. And we're going to be working on his urinary bladder channel. And there's 2 lines on either side of the spine. I had mentioned it's a great treatment for moving stagnation in the body, tune-up, if you will. Great tonification. So the needles, I'm not sure if any of you have had acupuncture, but the needles are very thin, almost like the width of a hair, paper, very, very thin. You comfortable? So I think I'm going to do, just because of time, we'll do needles in the top of the body, and then I can do some cupping down below. And then we use the vertebrae for locating specific points. And I'm going to treat the organs that we were talking about. So first we're going to go into the lung, which is at the 3rd thoracic vertebrae, about an inch lateral from the spine. And then we're going to go into the pericardium, which is at T4. So the pericardium is a heart protector. And in 5 element, someone who has an imbalanced pericardium might be someone who falls in love really easily, or someone who has their heart closed. So a healthy pericardium is like a swinging door. It opens and closes with ease versus being wide open or closed shut. So we have lung, pericardium, and heart. I'm going to do it. So there's an outer line. I'm just doing the outer line on the pericardium. And then we're going to come down to the liver. And so we really use anatomy in terms of location. So the bottom of this scapula bone is T7, and then T8, T9, the 9th thoracic. So this is the liver. And then I'm going to do some extra points. Do 8. That's the level of the heart. So good for anyone going through any heart transitions. We're going to do the spleen. So he has his mid-back, the muscles are pretty tight. And I find when muscles are really tight, they tend to grab the needle. So sometimes the insertion, like that last point, the insertion was a little tricky. So now we're going into the lumbar area, and I'm actually going to switch my needles. I was using 1 soon. I'm going to use 1.5 soon, just a little bit of a longer needle because there's some more meat in here. And this is one of the treatments that I learned in school, but you can adapt it per client. 12, 1, 2. So now we're at the level of the second lumbar. This is the kidney back shu. So these are back shu points for each organ. How's that feel? Yes, down here. So being that he's a surfer, paddling in that cobra-like arch position really tightens that low back. So his low back is pretty tight. I normally, if I had more time, I would do some body work before needling. So the muscles are a little more supple, they're looser, and they recede easier. And then I'm going to do the same thing on the other side. So this specific treatment's bilateral needling, so you want to do it on both sides. And I find it really engages that parasympathetic pretty quickly. Unless someone's had a bunch of coffee. I had a client once come in and she had 6 cups of coffee before she got on the table. So it took a while to downshift. She was in 5th gear.
That would be hard.
Yes. So, the woman who founded the school that I went to at Five Branches Institute, this is a treatment that we were taught called the Shen cycle. The Shen is how the spirit is housed in the mind, and it was very poetic the way she described it. It was, it's a treatment that was passed down through her family, and she described it as it's like going into a stream and sifting out all the old leaves and branches so the water can flow more smoothly. So it's a really great treatment because you're addressing all of the meridians for moving any stagnation in the 12 primary meridians. Great for stress, great for anxiety. Any of the points feel like they're screaming, too strong?
There, the other place again.
Okay.
Since after that, to get the lumbar,
Mm-hmm.
there, the tension in the muscle.
Okay. Go ahead and relax your head. Yeah. So, generally speaking, you leave them in to cook for 15 to 20 minutes. So, I really like blending modalities. So, let's say he was in for a treatment, I would then move into his feet or his legs with some bodywork. I use moxa, which is another modality that we use in Chinese medicine. It's derived from the mugwort plant. It has very deep heat penetrating qualities. So depending on what is being presented, being that Dr. Brad is very athletic, I would choose to do body work. So I would do body work on his legs while these needles are cooking. Let's say I had someone who was really stressed out, very much in their head, I would go into some reflexology. And I find working on the feet really brings people out of their head. It's very grounding. And then we're adding a gallbladder point in here, gallbladder 21. How's your memory and concentration been? Good? Okay. I think we'll stop there with the needles. I'm just going to go through and stimulate them. Does anyone have any questions that's here? So we'll leave those in for a few minutes, and then I'm going to go into some cupping in gua sha. Have any of you had acupuncture before? Okay, how about cupping? Gua sha? Okay. So I have a couple different gua sha tools that I'm going to use to help. It's kind of like a scraping motion. It helps separate the layers of connective tissue. I like to describe, healthy connective tissue as a fluffy croissant when it's healthy. And over time, with repetitive use of muscle groups, holding patterns, injuries, the croissant gets smashed. So what bodywork, massage, cupping, gua sha, all these things are doing is helping lift, separate, and encourage blood flow through all those layers of fascia and connective tissue. And then I do the traditional fire cups. So I'll be using these, and I'm going to get them prepped up. I like using 90% alcohol. And we use clipping forceps, so that's safe. And then I'm going to light this on fire, and then the heat in the cup is what suctions the glass to the skin. These are all glass. When I was in China studying, I saw some wild cupping treatments. There was a gentleman, they used bamboo cups in this one clinic we were in, and he must have had 40 plus cups all over his back. So they treat a lot more aggressively there because people are accustomed to the work. They've grown up with it. It was pretty amazing seeing how aggressively they treated compared to here. So I feel like there's a little bit more of a gentle approach to the work here. How you doing? Good. You feeling relaxed? Okay. So what time do we need to finish? 7:30. Okay, so we have 10 minutes. So you want to stay here for 5 more minutes? Okay. So I'm going to go ahead and do some, since we're running out of time, I'm going to go ahead and do some cups down here. With all that this man does, I would love for him to sit here for like at least 20, 25 minutes or more with the needles in. Please do. So I'm going to apply a little oil. Normally, I would have the needles out of the back, but I'm just going to cup his low back. So Dr. Brad, if the suction on the cups aggravates these needles here, just let me know, okay? I'm just trying to maximize time. How often do you get on the table, Dr. Brad? So that's true for a lot of practitioners, I think. But you're doing your yoga, which is great. Okay, so the cups are going to feel cold. So you can see those are going to feel a little cold to you. And these come in a variety of sizes. I personally, ooh, you okay? And then you can adjust the suction on these. I'm going to take these nails out. It's a little too close for me. So once they're on, I can adjust the suction. Are any of these too tight?
The one on the bottom left is top. This top.
Okay. So sometimes it makes that sound. I also like to do running cups where when they're not so tight, you run them up and down the muscle groups, which really helps release tension. Every time I have cupping, I feel like a gorilla's been pulled off my back. It really helps with tension in the muscles. Also good for, after any kind of respiratory viruses, coughs, mucus in the lungs, excess heat in the lungs. Fever, this is a really great area right here. Do 14 to cup when someone has a fever and or needle, or you can bleed that point. So I'm going to pull the needles and then just show you a little bit of gua sha. Do I need to? Okay. That was very quick, unfortunately for you. Is that suction okay? So if okay, so I have two gua sha tools. One of them is white jade, and the other one is made out of antler horn. And these you can use in lots of areas of the body. And there's different shapes on these, so you can, it's kind of more of a intuitive process as you're working on specific muscle groups, which side to use.
How much cascading?
I'd say like light to medium, not too deep. You would do much more pressure with, your hands and body work. Does that feel okay? So he has a lot of tension up in his upper back and neck.
Where can I?
And gua sha will sometimes leave marks similar to that cups leave, not always. So that's a very quick display. Salman?
Like,
You are free, yes.
so do I have any?
A little bit in your low back, but again, they were on so quick. That was fast forwarded.
Full like markings, which is from the cupping or the gua sha, right?
Yes. Yeah, the first time I see people, I prefer 90 minutes, so it's not rushed. I tend to really get into my work and go over more than like cutting treatment short. So I'd say 60 to 90 is ideal. Yeah. So she asked, in an ideal world, how often would you go for acupuncture? Ideally once a week, but it really depends what each client is presenting. Twice a month is also great. If something's acute, definitely once a week. When I was in China, I was surprised how often people were seeing 3 to 5 times a week. So they, again, treat very aggressively there. They get it done quickly versus dragging it out. So, and I think everybody's body responds differently. So if you are going to try it, it's best to commit to, at least once a week or every other week to see how your body responds. Some people respond like that and others don't.
So the question is, if you have chronic problems like chronic inflammation, how might Chinese medicine address it? Chronic inflammation may be causing atherosclerotic plaques in the heart and the coronary arteries. And there is inflammation for sure that can cause that. That leads to unstable plaques that then over time can become calcified. And also often the unstable ones can break off before they're calcified and create heart attacks. How might Chinese medicine address that, if at all?
Yeah, I think with something like that, obviously you would be working with your primary doctor. And I have found that it does help with inflammation. If you were going to choose that route, I would definitely recommend once a week and see how you feel, see how your body responds. It would really depend on what kind of pharmaceuticals you're taking, and you'd have to get an approval from your doctor to make sure there's no contraindications. The herbs are very powerful, and so there's lots of contraindications with specific pharmaceuticals and other things, but
Yeah, maybe just to lean in a little as the doctor in the conversation.
yes, please.
There was a recent clinical trial that's talked about that is published in JAMA that used an herbal formulation for people that had a history of heart attack and showed a reduction in death and heart attack. They don't know the mechanism. Was it through inflammation or what it might have been? But that's an example of Chinese herbal medicine improving the people's lives that are at risk for heart attack. Yeah.
Again, I would really recommend committing to a regular treatment schedule if you were going to try that route.
I think we're at our time. Thank you guys for your attention. We're here once a month. Thank you, Lisa, so much for my treatment and for all the explanation you gave today. And look forward to coming back next month. And thank you all for coming in person and being here live.
Thank you so much for coming. Thank you.
I hope you enjoyed the show today. We really learned a lot. If you feel compelled and want to learn more, please feel free to go onto our website and subscribe to our newsletter, as well as come onto our contact list. That'll allow you to get informed about future webinars as well as our upcoming retreats, and you'll have an individualized program to get the results you're looking for to optimize your health and your health span. Thank you for joining us today.